Hi, nurses. Welcome. This is NCLEX Prep 2.0, getting you ready for NCLEX. If you enjoy my content, please support the channel through likes, shares, and subscriptions. Thank you for those who have chosen to do so. Let's go over the phases of nurse-patient relationship. There are four phases that you will be tested on: pre-interaction phase, orientation phase, working phase, and termination phase. Pre-interaction phase. In this phase, the nurse gathers information about the patient from charts and other healthcare team members. This could be through bedside shift report, SBAR, patient chart. Information gathered could include patient medical and surgical history, previous admissions, immunizations, previous traumatic experiences, and this will help with the nurse being trauma informed and providing trauma informed care. The nurse may also review personal feelings or implicit biases about the patient before they go and meet the patient. Then we move to the orientation phase. During the orientation phase, this is kind of like an introduction where we go in and say, "Hey, my name is Nurse Jane. I'm going to be a nurse from 7 a to 7 p.m., and this is what we're going to be doing." So during this orientation phase, the nurse and the patient meet. Nurse introduces herself or himself for themselves and sets the expectations for their day or for their meeting or interaction. Termination phase of the nurse-client relationship begins here. And in your nursing school exam or on NCLEX, they can ask you at what point does termination phase start during the nurse-patient relationship? And the answer is during orientation phase. And this is how: my name is XYZ. I'll be your nurse until 7 p.m. or from 7 a.m. to 7 p.m. So this already sets an expectation as well as it preps your patient's mind that by 7 p.m. this nurse will be gone. So they get some time, they know that I have up to this point to say this or not that or how to behave. So termination phase of the nurse-client relationship begins during orientation phase. During this orientation phase also, initial assessments are gathered through doing your nursing assessments in depth, or if it's just going to be surface level. We also create a rapport during this time with the patient, building trust and empathy. You could use words like everything said here will be confidential. And this helps them to trust you and be able to open up and give you as much information as possible that you need to help with their care. We also, during this orientation phase, we do set the rules and goals for the relationship. That, if let's say the patient is here for procedure, so the rules are like, you're going to be NPO until you go to your procedure. When you come back, we'll, blah, 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 and so forth. Another thing I want to mention about this phase is the testing behavior. You will come across this question asking you about this testing behavior, and it happens during the orientation phase. What is this? Testing behavior is where the client tries to determine if the nurse will accept them and stay with them despite them not knowing each other. For example, the patient could play hard to get, or kind of stay closed in. It's hard to get information out of them, and that could be in the initial phases of the assessment. And just because you are new, they have never seen you before, it's uncomfortable to disclose private information. So the patient is trying to see if they can trust you, if they can trust you with their life, with their private information, and this is called testing behavior. Then we move to the working phase. This is the longest phase where most of the work is done. So we take the patient to CT scan, we take them to a procedure, we do physical therapy, all those good stuff. The nurse and patient actively work together to identify and solve problems. Tasks include providing education, encouraging the patient to practice coping skills, evaluating progress towards goals each and every day. Then we come to the termination phase. This phase occurs when the mutual agreed upon goals during the orientation phase have been reached and the patient is being discharged. The nurse and the patient summarizes the achievements of the relationship and discuss the patient's ongoing care and plans. The nurse allows the patient to express their feelings about the termination, which may include sadness or grief. You will come across this question where they'll test you and ask you where at what point in the nurse-patient relationship is there the patient showing signs of grief or sadness. Usually it's during the termination phase where or especially for patients who had built a rapport, a solid relationship, or friendship with the nurse or the team that were taking care of them, and they feel sad to leave. Thank you for watching. If you enjoyed this video, please like, share, and subscribe to help me grow this channel. Look out for more content and see you in the next one. Bye.